Welcome everyone to this webinar today, which is talking about the social protection indicator for the Pacific, looking at tracking developments in social protection across the Pacific region. So I'd like to begin by welcoming everyone who may be joining from Asia. Good morning to you. Good afternoon to all my colleagues and friends here in the Pacific region, and if there is anyone joining us from further east, as it were, from the Pacific, good evening to you, because I think in the States and so on it'll be late in the evening. So anyway, let's quickly go through what's going to happen today. This webinar will present the main findings of ADB's forthcoming publication, which is entitled The Social Protection Indicator in the Pacific, specifically providing an analysis of the data from 2018 on social protection programs in the 14 developing member countries of the ADB across the Pacific region. This work updates the analysis that was last conducted in 2015, but although it's focused on 2018, it does pay homage, so to speak, to the events that have happened over the last couple of years that have had quite a material impact on the approach and the consideration of social protection in the Pacific region during the COVID pandemic. So today's agenda, if we quickly run through this and give you an idea of what's going to happen. The opening remarks for today's session will be delivered by Ananya Basu, who is the Director of the Social Sectors and Public Sector Management Division in the Pacific Department of the ADB. Ananya is a very experienced economist and manager in the ADB, and she will be delivering some opening remarks for us. Then the main body of the webinar will be a presentation by Margaret Chung, who has been the lead author for the work that's been undertaken. Margaret is well known to most of us, many of us across the Pacific, where she has been a consultant with around 30 years of experience. Margaret will take us through the main findings of the latest round of the social protection indicator, and I think we'll all find that very interesting to see how things have developed over the last few years. There will then be a presentation, a shorter presentation by Dr. Michael Sampson. Michael is the director of the research of the Economic Policy Research Institute, and he, like Margaret, has many years of experience in working in social protection and specializes in designing and implementing, monitoring and evaluating social protection programs. And he will speak on the future for social protection in the Pacific region, an area where a lot more attention is being paid and has been paid in recent times with the impacts that have particularly happened through the COVID. We will then have a presentation, a short presentation, a reflection, if you like, from Alex Ivashenko, who is with the World Bank, and he's going to reflect on what's been going on in the region over the last few years. He's been a senior economist with the Samoa Resident Coordinator's Office, covering Samoa, Cook Islands, Niue, and Tokelau. Sorry, I said he was with World Bank. He's with the UN. Then we'll move on from there for another presentation, a country perspective from Grace Chinoweth, who is the chief of the Child Poverty and Social Protection section in New York, where she has previously been with the Ministry of Internal Affairs with the Cook Islands. So we will get a perspective from Grace on the social protection situation in Cook Islands. We'll then have a short question and answer session, and we look forward to any questions that you may have on the presentations. We'll have a final closing session with Wendy Walker, who is the Chief of the Social Development Thematic Group in the Sustainable Development and Climate Change Department of ADB. So I think that's, we don't want to waste any more time on the introductions. So what we'll do is we'll move straight in, and I invite Ananya to make her opening remarks. Thank you.
Thank you very much, David, and hello everyone. I'm Ananya, and it is a great pleasure for me to welcome you to the webinar on the Social Protection Indicator for the Pacific, tracking developments in social protection. As we all know, COVID-19 has placed social protection at the center of global attention. The pandemic has highlighted the essential role of social protection systems in responding to crises and shocks from external sources, particularly those that affect the poor and vulnerable groups. We hope that today's webinar will further the discussion on how the government and key partners can establish effective, adequate, and efficient social protection in Pacific countries. The SPI serves as an important tool for government and policymakers since it captures the adequacy of social protection in terms of government expenditure and social assistance, social insurance, and labor market programs. It also captures key data like number of beneficiaries, the size of the benefits, and the distributional impacts of social protection in terms of poverty and gender. For the first time, the issue of disability in the Pacific is included in the assessment, as well as lessons learned from COVID-19. The comprehensive data will be an important source of social protection statistics to guide policy options in Pacific countries and ways to strengthen the social protection system. I look forward to the next 90 minutes of interesting presentations, followed by what I hope will be active discussions. Thank you very much, and I will now keep it short and turn you back over to our moderator, Mr. David Abbott, who's Manager for Data Analysis and Dissemination with the Statistics for Development Division of the Pacific Community, or SPC. Back to you, David. Thank you.
Thank you very much indeed, Ananya. And now let's move into the main body of our webinar today, which is a presentation by Margaret Chung on the findings of the analysis so far. Over to you, Margaret.
Thank you, David. The next, Paula. Yes, this report is based on 2018 data on social protection. Oh, okay. Excuse me, yes. Is this for right now, Paula? Okay. It is the fourth in a series of national and regional reports starting from 2009. And we're using the social protection indicator to assess the nature and effectiveness of social protection expenditure in and across the 14 Pacific Island countries that are member states of the Asian Development Bank. Next. So just to briefly recap what we are talking about in regards to social protection, these are policies and programs that are designed to reduce poverty and vulnerability, either by promoting labor markets or otherwise reducing people's exposure to risk and helping them to protect themselves against common hazards and disruptions. The three main categories of social protection that we discuss here are social insurance, social assistance, and active labor market programs. And taken together, the social protection indicator is the level of national investment in all three categories, expressed as percentage of GDP per capita. Next slide. The overall findings of the Pacific Region report was that there have been small but significant recent changes to national investments in social protection. There's been an increasing range of social protection programs, specifically social assistance programs, more of them addressing particular vulnerabilities such as disability status and older age groups. And there's a widening array of contributory social insurance programs, including more opportunities for health insurance. There are also new national commitments, particularly in regards to the CRPD, the Convention on the Rights of People with Disability, to addressing needs of people with disability, which require more targeted programs and funding. The COVID pandemic, of course, revealed the need for more agile responses to social protection, moving away from the more traditional bureaucratic systems. And there are new choices of response, which the next speaker, Michael Sampson, will discuss. Next slide. So in the Pacific, social insurance accounts for the largest SPI. And these social insurance programs are contributory programs such as retirement funds and health insurance. Generally in the Pacific, they are the national provident funds. The proportion of SPI that is regards social assistance is smaller, and labour market programs tend to be very small indeed. Next slide, please. Now, when we're talking about the Pacific, of course, in every region you'd expect diversity. In the Pacific, there's a great deal of diversity. And this slide illustrates this in regard to the countries to the left, which have got the highest SPI and the highest percentage of expenditures as a percentage of GDP, across to the countries to the right, such as Papua New Guinea is the most furthest to the right, which have the lowest SPI. Next slide, please. Now, when in discussing the coverage or the breadth of SPI expenditure, it's quite a low figure. Social protection in the Pacific covered only 40.2% of intended beneficiaries in 2018, and many eligible people missed out on receiving support. The figure has risen, but nonetheless. And there are many reasons why this would be so. I could give a quick example from Fiji, which I know best, where although there's a social assistance programs, there are always more applicants than recipients. And there are other examples we could come to. Social insurance has the narrowest coverage, and most pensions cover only older people. Superannuation benefits are only to people who've been in paid employment, and in some countries, only to people who've worked in the civil service. The active labour market programs have the most restricted coverage, intended to help people who are out of work, who need training or assisted entrance into the labour market. In fact, very few people get to participate in these programs. Next slide. The depth of benefits refers to the average amount that people receive. Now, social insurance has the greatest benefits, but to the fewest people. And that's why you see the figure is over 100%. And that means that the benefit is relatively large. The benefits from social assistance tend to be smaller. So quite a few people receive small benefits from social assistance programs. The average benefits from active labour market programs were larger, but the pool of beneficiaries was very small. And again, there's very wide variation in these values among the Pacific Island countries. Next slide. This figure here sums this up pretty well. You see the dominance of social insurance, which is blue. You see the growing area of social assistance, which is orange. And you see at the top the very tiny labor market programs, which have doubled in size from 0.1% to 0.2%. So they're coming from a very tiny base. Next slide, please. So although social insurance programs are by far the most dominant section of social protection, this dominance has decreased slightly as the area of social assistance has grown. And expenditure again on active labor market programs have grown, but from a very tiny base. Social insurance remains dominant because of the very large sums of money that are created by contributory retirement schemes, such as national provident funds, and in some countries, increasing opportunities for health insurance. The growth in social assistance reflects the rising value of individual benefits, but more importantly, the larger number and range of programs. There is increasingly universal benefits, such as pensions to older aged people or benefits to all school children. And this is a movement away from what were often very tightly restricted social assistance programs. Next slide, please. And again, this figure sums this up. We see that the breadth of programs, the overall depth of programs, which is the green line, decreasing because instead of you've got more people benefiting from social assistance programs, which tend to be smaller benefits. And we see the orange line, the overall breadth or the percentage of target benefits rising slightly, rising not by much. Next slide, please. And this slide just gives more details about these changes that I've just referred to. In terms of the breadth of social protection coverage, the largest increase was in Palau, and that was due to expanded social insurance, particularly social health insurance programs. And in Fiji and Nauru, the increased breadth of coverage, for example, was due to newer social assistance programs. And again, the depth of social protection programs has changed, but there's a great variation around the Pacific. Solomon Islands, Samoa, and Marshall Islands all saw overall gains in depth. But the depth decreased in Nauru, Vanuatu, Palau, Fiji, and PNG, again, because of this larger range of social assistance programs and more widely distributed benefits. Next slide, please. The impact on poverty. Because of the dominance of social insurance, which benefits people who've been in paid employment or in the formal employment sector, they're not at all usually the poor. So we see that there has been a swing from a very dominant non-poor. There's been a swing towards the poor in most countries. And that's again because of the wider availability of social assistance. And the bottom slide again just illustrates the great variability in the region. Next slide, please. In terms of the gender balance, there's always been an advantage to men. And again, this boils down to the dominance of social insurance. Men hold the greatest share of formal sector jobs in the Pacific and with higher average rates of pay than women. Therefore, in a contributory fund, men on average get greater returns. Now, the gender balance was evident everywhere in 2009 and 2012. But throughout the Pacific, the gender gap has become minimal or not as evident in most countries. We still see quite a big gender gap in Kiribati. We see it also in Fiji, Niue, and also Solomon Islands. The narrow gap also reflects, interestingly, that where we've got social assistance programs, especially for the elderly, women predominate because of their average greater longevity. Next slide. This is the first time that the SPI has been disaggregated for people with disability. And the regional average SPI in 2008 was 0.5% for people living with disabilities, but an average of 5% for people not living with disabilities. So even though there has been an increased attention given to programs to specifically assist people with disabilities, there still is a long way to go in this regard. And again, it will never become fully equitable, again, because people with disabilities are less likely to be in formal employment. That is fortunately changing. But the dominance of socialist insurance, again, plays out here. Next slide, please. There are very important movements in regard to people with disabilities, in regards to meeting the responsibilities of governments to their international and regional commitments to address the needs of people with disabilities. 7 of the 14 countries in the region now have programs, social assistance programs, specifically catering or meeting the needs of people with disabilities. The difficulty, however, is that it's difficult to disaggregate data on mainstream social assistance programs. We know how people are benefiting, or people with disabilities are benefiting from specific programs, but we've got a long way to go before we get adequate data regarding other programs, the mainstream programs. Next slide, please. And so, I mean, we could simply say here that more needs to be done to meet the needs of disabilities in regards to meeting a fully inclusive social protection programs. Governments rely heavily on development partners and civil society organizations to provide services and support for people with disabilities. Next slide, please. As David Abbott mentioned in his introduction, the COVID-19 pandemic has pointed out a lot that social protection systems maybe need to adapt to the Pacific region. COVID-19 is, of course, just the latest crisis. The Pacific Island region is highly prone to disasters of many kinds, particularly natural disasters, and they are very vulnerable to the impact of climate change, in which we're already seeing some of those impacts. So in the case of the COVID-19 pandemic, governments responded quickly to declaring states of emergency, to implementing contingency plans, and so on. However, even with these, while infection levels were kept low initially, the economic and social costs have been significant. And again, just as countries believed or governments believed it was safe to open up borders again, then came the Omicron variant, and we had really dangerous spreads of COVID in a number of countries in late 2021 and early 22. Next slide, please. So the closing of borders had a huge effect throughout the region, particularly in countries which were very tourism dependent. Across the region, GDP declined almost 6% in 2020 and 21. The human impacts have been profound. Loss of livelihoods, restrictions of movement, stress, food insecurity, education losses, mental health disorders, family, gender-based violence, the whole panoply of social and economic impacts. And of course, as always, vulnerable populations had a disproportionate impact. Next slide, please. So although Pacific governments were quick to repurpose existing social protection mechanisms and create new ones, it was a matter of moving quickly to make these changes. A lot of social protection systems in the Pacific have long application processes, long vetting processes, they're means tested, and so on. So changes or repurposing existing mechanisms worked to some extent, but they showed up, in fact, the need for more agile systems. Next slide, please. And some governments were able to do this more readily than others. And of course, it aided very much by the international development partners and by international and national NGOs and community-based organizations. So the value of the National Response Package in Fiji was around $2,800 per capita. But in Solomon Islands, it was very much smaller at around $56 per capita. But we have to add into that the very generous and strong support of development partners, and bilateral and other donors, and the NGO community. Next slide, please. So again, this is really sums up what I've just been saying. And it's very good to know that in the World Bank and ADB helping some of the countries as taking the lead in applying the lessons of this large and abrupt crisis towards designing new national social protection policies. Next slide, please. Our next discussant, Michael Sampson, is going to go more closely into this issue of future prospects and opportunity for social protection in the Pacific region. there's better awareness in the region, amongst governments of the region, that social protection instruments help community-based mechanisms, the reliance on family, on kinship, and so on, in tackling hardship, vulnerability, and risk. But increasingly, this is not enough. And it's a good opportune time now to consider what the future of social protection in the Pacific region might involve. And there's a number of, Michael has identified 5 trends in these future movements. I won't steal his thunder here by discussing them, but I'll leave them to Michael. Thank you.
Thank you very much indeed, Margaret. I think we would all agree that there's some very interesting numbers in there, and the fact that the COVID pandemic has helped to, as it were, focus much more attention on this really important area of policy that in the past has perhaps not been given as much attention as it warranted. Largely, one might say, because traditionally the Pacific region has been one where families and kinship groups are very much focused on caring and sharing with their own. But the increasing frequency of disasters and now the COVID pandemic has really begun to bring it home to senior leaders within governments that the traditional systems really no longer stand up to the scrutiny that they're being placed under when such things happen. But even so, what we have also seen is that there are still a large number of people who are in what we might call the missing middle, as Margaret has indicated. The breadth of coverage of social protection in the region is only reaching about well, not much more than 20% of the total population. So we need to look at these things, and this is where our next presenter, Michael Sampson, is going to talk about, as Margaret has said, the future of social protection in the region and what can be done to improve the coverage across all sectors of the population. So, Michael, over to you, please.
Thank you, David, for that great introduction. And Margaret, thank you for that excellent presentation, which really makes my job easy, talking about the future based on the history that you've mapped out with the SPI. And let me thank all of you for the opportunity to share these ideas on the future trends. The next slide gives us a 1-minute history. In the Pacific, we've seen a long and important history for traditional and informal systems of social protection. But over the past few decades, we've seen changing patterns of shocks and risks, moving from the kind of idiosyncratic kind that affect just a few people in a community, things that traditional systems can cope well with, to more covariant risks that affect entire communities, entire nations, the entire world. And the 2008 global crisis created an impetus in the Pacific, as in the rest of the world, for further development of formal social protection systems. And various natural disasters have accelerated this trend. And we're seeing with COVID, even more this acceleration in important ways. And as we just heard from David and earlier from Margaret, it's exposed the vulnerabilities of the missing middle. And I want to highlight another important trend, which is the demographic forces in the next slide. These are demographic pyramids that show the country. So if we go to the next slide, we'll see the demographic pyramids for a few example countries. Other countries have very similar patterns here, from the traditional pyramid shape a couple of decades ago to a very distinct youth bulge in low-income countries, but even shrinking populations in a number of the higher income countries. And very clearly in the future, a very strong aging, which highlights the need for a new social contract, a social contract that's going to ensure in the Pacific that labor productivity can rise faster than populations age. And we're going to talk about how social protection can help support that. The next slide illustrates some of the trends that have been accelerated by COVID-19. It's been a game changer. It's demonstrated the power of crisis as impetus. And the Pacific has benefited, I think, from global consensus influences about the increasing importance of social protection. Of course, there have been a diversity of regional responses, some countries focusing on social assistance, some on social insurance, others on the labor market activities. But very clearly, we've seen as countries shift from response to recovery, an understanding of the importance of the social dimension. And decades from now, when we look back on the great pandemic of the early 2020s, it's not the economic shock that people are going to remember. That's going to be forgotten, a blip in the resumption of galloping economic growth. It's the social shock, the inequality shock, the gender shock, the human capital shock that will leave the deeper scars or perhaps still festering wounds. And the role of social protection to provide a link to services and bring more comprehensive approaches is the second wave. I want to talk about these trends in the context of these three waves. And of course, the response to the pandemic has created fiscal shocks that may lead to more substantial changes in the fiscal order. But perhaps most importantly, COVID-19 is a precursor of future shocks. It's an uncertainty shock. It's an all of society shock, like, yes, climate change. So the next slide will show us a little bit about the first trend, which is really a trend that has been progressing for decades. It's the first global wave of social protection, improving coverage for vulnerable groups. Countries in the Pacific increasingly adopt life cycle approaches that highlight the importance of progressive expansions of coverage. We've just heard from Margaret about the increasing emphasis on benefits for people with disabilities. The COVID-19 lessons have illustrated the gaps in the missing middle that David and Margaret just referenced. And this response has demonstrated the power of social protection to build resilience to future shocks. I want to talk also in the next slide about the second wave, a wave that we've seen forming for the past decade, more comprehensive and integrated approaches to social protection plus. Demographic changes are interacting with economic patterns, along with COVID-19 as an accelerator to propel the importance of early childhood development and its links to social protection. The Pacific is a model region in the world. If you look at the way the Pacific Regional Council for ECD has demonstrated regional commitments, and very importantly, COVID-19 is changing both work norms and work technologies in a way that overcomes one of the Pacific's traditional barriers to competitiveness, and that is remoteness. If people can work from anywhere, if knowledge industries are increasingly important, then the Pacific's comparative advantage is elevated. Knowledge products can flow from Fiji or Papua New Guinea over fiber optic cables, as easily as from Singapore Valley, as easily from Silicon Valley or Singapore. These changing work norms create an opportunity, but only if the region harnesses this by investing in human capital and cognitive capital. And we've seen the governments demonstrating this commitment. It shows great promise for linkages between early child development and social protection. Similarly, the next trend, a focus on youth development on the next slide, will demonstrates the government's commitment to productive investments and linking social protection to livelihoods development. We see this with similar regional commitments and a range of country programs that link employment and livelihoods. PNG's Urban Youth Employment Project is one promising example. Perhaps an even more promising example is the Integrated Aged Care Project in Tonga. That is a triple win. It's providing benefits for vulnerable households through aged care. It's skilling up a labor force in order to realize and tackle the challenges of aging societies. This articulates an intergenerational contract where, looking at that previous trend, governments invest in children, build human capital, raise a more productive labor force in order to finance the social protection support for people in their old age. The next slide highlights fourth trend, and this is the role of inclusive digital technologies. The pandemic has demonstrated more clearly than ever before how important inclusive digital technologies are. I won't go through the country examples, but in every country, we've seen some investment by governments in digitalizing social protection. And that builds a core infrastructure that helps strengthen strategies for development. The pandemic has demonstrated how important technology is for emergency remote learning, for telehealth, for e-markets, for adaptive livelihoods, for using technology to deliver social protection more effectively. Of course, there are risks here. There's a risk that unscrupulous operators will take advantage of these new technologies if there is not sufficient consumer protection and financial literacy. But just like in the first wave, cash transfers were a viral app that made markets work better for the poor. As we look to the future, information transfers, access to the internet and access to these technologies will be another viral app that will make markets and governments work better for the poor and vulnerable. My last slide before I conclude speaks to the third wave. And if we go, and here we've seen across the region an increased focus by governments on national social protection strategies. The ADB is supporting in PNG and Nauru, the UN in other countries, and these are helping to build linkages to social services that help also propel that second wave. But perhaps most important in this third wave is the increasing focus on optimizing that mix of development and climate and equity strategies, using social protection to strengthen both climate change adaptation and to build better strategies for climate change mitigation. We're seeing social protection playing a vital role in the just transition to a green and sustainable society. So my next slide, let me conclude just by highlighting that even before the pandemic, we saw a progressively growing commitment by Pacific countries to social protection. And certainly COVID has accelerated this trend, maybe overshooting. It's hard to predict at what level the commitments to social protection will equilibrate. but certainly at an elevated role in achieving the core goals, tackling vulnerability as part of the first wave, as part of this second wave of integrated social protection, strengthening life cycle approaches, investing in children, producing better opportunities for youth, breaking new ground with digital technologies, and perhaps most importantly, moving towards a just transition towards a green and sustainable society and economy. Thank you so much. Back to you, David.
Thank you very much, Michael. That's a very thought-provoking presentation, and I think it does really emphasize the need for more and further detailed consideration to be given by Pacific Island governments on the future course of social protection in each of their particular countries, taking account of the individual circumstances in which they find themselves. So perhaps if we can move on to our next presenter, Alex Ivashenko, who will give a reflection on the work that's been done over the last couple of years in putting together the new social protection indicators from his perspective with UNDP in the country office of in Samoa. So over to you, Alex.
Thank you so much, David, for your introductions, and I would like also again to welcome all the participants in today's seminar, and thank you also Margaret and Michael for excellent presentations. Again, just wanted to introduce myself. I am a senior economist with UN Resident Coordinator Office in Samoa, covering Samoa, Cook Islands, Niue, and Tokelau. But I have also come with a long career at the World Bank, including social protection and jobs global practice. My task today is to talk briefly about the connection of monitoring social protection data with implementation of social protection in the Pacific region and its contribution to evidence-based policy making. I would like to drive home basically 6 key points. 3 of those points are going to be basic facts that again put this important work in the context of Pacific, but also in the global context. And 3 other points will be related to why this ADB SPI report is important from a policy perspective. So let me again start with those 3 basic facts. So fact number 1 is that capturing high quality social protection data in the Pacific is notoriously difficult. And it is because the household surveys are far and few between, with low frequency, and the survey design that is often not necessarily done with the social protection capture in mind. And you know, to tell one story here, I come from a background of working in Europe and Central Asia region. And there you find that many statistical agencies, they do surveys, household surveys on a quarterly and at least annual basis. So when I first joined the team working in Pacific region, I actually was terrified when I found that in the Pacific region, many countries do household surveys with a 5-year frequency. And that has been actually something that we're still facing there. And so in this context, I think that regular work on the SPI by the ADB, I think it makes invaluable contribution to building the social protection evidence base in the region. Because when the teams gets to each country, basically the task of the team is to basically capture all the possible data they can find on social protection. And I think it's very invaluable, especially as already mentioned in the region with a very scarce and sometimes very poor quality data. That was fact number 1. Fact number 2 is that many Pacific countries have traditionally relied on informal or community-based systems of social protection. I would dare to say here that very often that has actually been used as an excuse for not expanding the formal programs. However, and I think David also alluded to this before as well, these informal systems are increasingly found not to be sufficient enough in terms of the broader population coverage, adequacy of benefits, and overall ability to protect population from a rising number of shocks, which are also becoming more complex and compounded in their nature. Finally, fact number 3, as this report rightly indicates as well, is that Pacific countries are very diverse in terms of their protection system development stages. While many countries still have only a few narrowly focused programs, and actually Samoa is still one example of that, where basically there are only, in terms of formal social protection programs, there is only senior citizen benefit and provident fund pension, which basically results in a social protection system where 90% of the benefits benefit 10% of the population. That is one extreme or example of narrowly based system. On the other hand, there are some other countries, I would highlight Fiji and Cook Islands here, which have a very wide range of programs, I would say quite modern systems of social protections, including benefits that targeting the very poor. So I think it's very important to understand these 3 basic facts when we look at what is happening with social protection in the Pacific region. In terms of my next 3 points, they're going to be about about 3 reasons why this report is important from policy perspective. So reason number 1 is that this 2018 SPI report provides an important pre-COVID times baseline. Actually, I was thinking about it and I thought it actually needs to be probably called 2018 and beyond, because it actually does reach so much more in terms of indicating already what has been happening during the COVID times, what are some of the future trends that's already observed, which not necessarily yet are captured with the data that we have. And we know that many countries globally have got on a path of expanding social protection programs to respond to negative economic and social challenges caused by COVID. But since then, the world has faced new challenges, such as rapidly rising fuel and food prices triggered by geopolitical events, such as the current war in Ukraine. And this baseline report helps establish where the SP system in the Pacific was in the pre-COVID times, and it's in this environment, which already described, it goes well even beyond what was happening during COVID times. And this report already indicates, as also Michael very nicely alluded in his presentation, directions of SP policy changes that is already taking place. And I think we should all really look forward to the next report, because we hopefully some of the new data that will be coming out will help us capture in terms of numbers what is really happening in the region as a response to some of the shocks that I have described. Reason number 2 is that this SPI report shows a rising range of SP programs, which is an important development in the Pacifics in terms of building broader, more inclusive systems of social protection. Such systems are also better suited for the provision of social protection in times of disaster response by allowing both vertical and horizontal expansion. Example of that work, actually, we've been already doing, the World Bank was doing when I was also there back in 2016 as a response to tropical cyclone Winston, where additional the benefits were provided to beneficiaries of the poverty benefit scheme, which targets the poorest 10% of households in Fiji. And we have actually showed through impact evaluation that these transfers help the households recover faster from the shocks that they have experienced. This is only possible when you have a targeted and broader range of programs in place, because unfortunately informal systems of support cannot provide this type of adequate response, especially when the whole communities or villages experiences the same disaster situation. Finally, reason number 3 is that this SPI report also hints that further refocusing of SP system in the Pacific is required, with a more significant emphasis on expanding social assistance in particular, with respect to both expanding coverage and adequacy of benefits. I believe that this refocusing is especially important now that the prosperity of the Pacific people is under real threat from the rapidly rising commodity and food prices. Indeed, recent CPI data for Pacific countries indicates that, for example, in Samoa, if you look at April CPI index, the prices have risen by 9.5% compared to April last year. That means basically that people in the Pacific are going to be 10% poorer in real terms a year from now. And this is not an example only of a specific single country. Even we know that in the United Kingdom, the inflation is 9%, which is the highest it has been in 40 years. Inflation in the United States is at 8.5%, which is the largest number it has been in 35 years. So it's a global phenomenon, and I think we really need to pay much closer attention to what will be happening with the prices of goods and services in the Pacific region, and think how we can actually adjust existing systems and programs of social protection to be able to respond adequately to these new challenges, because the current setup of a SP system can no longer ignore this type of trends. And actually, this environment calls for stronger and more targeted programs to protect the new poor and vulnerable. So these are the messages that I wanted to convey on my side, also from somebody who is spends a lot of time in the Pacific region and monitoring also macroeconomic data as well. And again, thank you very much for all the presenters, and thank you to IDB for opportunity to reflect on this wonderful program. Thank you.
Thank you very much indeed, Alex. You've certainly raised some really important issues there, and I'm sure that we shall be getting some questions, and this will come up, or these points that you've just raised will come up in the discussions that we have. But before we move on to those, I'd like to invite Grace from the Cook Islands to give her perspective from a country point of view. So Grace, over to you, please.
Yeah, thank you, Kiarana from the Cook Islands. So yeah, basically I'll just get straight into it. Thank you to all the presenters for that comprehensive presentation, very informative. So basically our reaction towards the SPI for the Cook Islands is a very useful tool for us to provide ongoing analysis of our social protection system. It also helps us to look and reflect on our current social welfare benefits. And the last report that was done by Hillary also provided us the chance to discuss all the findings with other government agencies and also consider all the recommendations that were provided. So for the Cook Islands, we have this wide range of benefits, and already having the system in place really helped us to be able to provide assistance as part of our COVID-19 response to support the vulnerable, and also those that were newly unemployed, people facing hardship, sole traders, and also the private sector. However, even with the Cook Islands having this wide range of benefits, there were still challenges that that were needed to be addressed, and it was also identified in all the reports that was done by Hillary and other international donors. So for us, one of our biggest challenge was and still is our policy. There is no policy in place, a clear policy in place for our social assistance programs. that gives us a really clear objective of what we are trying to achieve here, or what impact are we wanting these programs to have on the well-being of our people. So what we basically have is just an admin policy with lots of gaps in it and challenges from the public about the whole process. So for us, having a policy in place is crucial in enhancing the current system and ideally making it more comprehensive and adaptable. So future planning. So we do have a plan in place in discussion with UNICEF to develop an overarching social assistance policy, which is happening in the next few months. And we're looking at securing funds to support TAs that will be doing a lot of consultation on our behalf and helping us to come together and put this whole policy in place, which we believe would minimize or mitigate all the challenges that we're currently facing in terms of our process and criteria of our programs. But really, the aim is to be more clear as to what we are trying to achieve in the social assistance space. So that's a very exciting activity that we're looking forward in the next few months. And also would like to inform all that we're also developing a management information system. We're currently in the process of deploying this over to the government network. So that was initiative that was brought up last year, as I mentioned, as part of all the reviews that's been happening. It's fundamental for us to get into using management information system. And like what everyone is saying, COVID has really pushed us in this area to see the importance of digitalizing everything, the whole process of social assistance. So this is something we're also looking forward to. And for us to future, this would mean that we would be able to produce disaggregated data for our social welfare beneficiaries. Especially for now, an example would be our elderly people. One of the challenge we face is that we do have information on our elderly people, but in terms of their mobility and disability level, these kind of information we lack. So we're hoping that having the system in place would enable us to have a more robust social assistance system to be able to really reach out to our most vulnerable in our community. So in terms of the coverage for social assistance programs, we do see it is expanding, and due to multiple awareness during COVID, there was a lot of awareness in this area. Even with COVID having a negative impact on some area aspects of people's life, for us, there was a little bit of positive impact there in terms of people not receiving the support. They're aware of the support, but basically pre-COVID, it was not something they wanted. They were honest. They were okay in terms of their income, but when COVID hit, they kind of felt the financial pressure. So it saw a few very significant number of people come on to the social assistance program. So we did see that as a bit of positive thing for us now that we have a little bit more of people being able to come and receiving the support, especially during COVID, as a lot of people were affected with loss of income. There were also reduced income among households. So having this access to the support was very beneficial for them. Yeah, and also with all our targeted programs for vulnerable people, we're also expanding on that. Where the government see with COVID, when COVID came, we saw a bit of shortage among the CSO, NGOs. So the government were able to review and reprioritize its funding and activities to cater for the CSOs' needs. But really, the focus is to give them that support to be able to support our vulnerable people out there. So there were a little bit of flexibility around our policies, and that allowed us to help our people access support immediately, especially during COVID. And also with the infirm benefit, even with the, there was a report that was done 2013-18 by UNICEF, which recommended for a gradual increase with the infirm disability benefit. However, we saw COVID as an opportunity, not only an opportunity, it was basically the right time to push for this support to be increased to a very high rate, which would have been done long term. We were able to do it within a 1-year space, because we did see the need where the challenges were basically with the caring family members for these disabled people. We saw the challenge, financial struggles, where they had the reduced or lost their income. Now they're finding it difficult to support this infirm or this disabled persons that they're caring for. So it was necessary, and it was a success for us. So we were able to be more flexible with the support of the Ministry of Finance to actually invest a little bit more into our disability community. So that was a great push for us and an achievement. So with the COVID response activities, so I'll just briefly run through that. So with the Cook Islands, there's quite a few products that we created, the Emergency Hardship Fund. The policy around that was a bit strict. There was no flexibility. We found there was no flexibility because it was mainly targeted towards COVID-19 related cases. So it was a bit hard for us in terms of those that were destitute pre-COVID to actually come on this support during the COVID period. So, however, the process was quick, and the challenge was basically around monitoring these people on the Emergency Hardship Fund, where we have to, as we have a goal to shift them and put them back into the workforce. However, the availability of work with their type of skills were not there. So the employment services platform were created where employers put up job vacancies, and where people go on and look for job or sell themselves to employers to find whatever available job they have out there that these people can access. So that was a really useful platform for us, the employment services, that we get to help people move them from hardship back into employment. We also had the unemployment benefit, wage subsidy, business grants, which was managed by a Ministry of Finance. And then with the COVID came, so we had the support called the welfare pack. This is a food distribution we had. So had a bit of challenge with the policy as well, but it's mainly because of all the changes with the measures around COVID-19 by the Ministry of Health. But however, we were able to quickly adjust and make sure that the support is out there as soon as possible. And so moving forward, sorry if I'm going too fast. So moving forward, the Cook Islands is supporting gender equality. So at the moment, there is a proposal in place to increase the government maternity leave funds from 6 weeks to 12 weeks. And with that, we're also introducing a 2 weeks proposal as well to increase the 2 weeks government paid paternity leave for the fathers as well. So this is one of the main areas that we'll be working on in the next financial year. And also providing a more comprehensive disability support by increasing the child benefit, mainly targeted for children with disability. As we all understand, there are more challenges among these group of children compared to children without this disability, and also the pressure on family members caring for them. So we're also looking at that, looking into assessing the level of support that's required for these vulnerable children. And other future plans is to review and adjust our benefit rates as well, according to the inflation that we're currently experiencing. So next month it's been approved that our old age pension will be going up again. So there'll be a little bit of increase with our old age pension coming in the next month. And there's also a proposal to look into reviewing the destitute, as we're currently seeing the cost of living that's going up currently in the Cook Islands. So that's something we'll be working on strongly in the next few months and hopefully achieve it before the end of the year. And on the side of employment, the review of the minimum wage has gone up. So that has been approved, and this will be happening next month, July. So a lot of things happening in July in terms of the increases, change in minimum wage. But yeah, that's the forward thinking of the Cook Islands at the moment. A lot of activities that needs to be looked at, and apart from the policy and the MIS system that we're currently working on. So yes, would like to thank you for the opportunity to share what we're currently going through here in the Cook Islands and our forward plannings. Thank you, David.
Thank you very much indeed, Grace. I think what you've covered there is really important in the context of the rest of the region. And I was particularly interested to hear that you are anticipating looking at developing a comprehensive social protection policy over the coming months, because in fact, this leads into one of the questions that we have from Ravita in the Q&A box, which she's asking what the panelists and you, Grace, would how best to determine how much benefit should be given to beneficiaries, or what should be the adequacy level of benefits. Because when we look at the SPI, we calculate this on the basis of a percentage of GDP, and she asks, is this an appropriate level to make the comparison? Should we be looking at another benchmark, so to speak? So perhaps I could ask Michael first if he has any thoughts on how best to identify the level of benefits that should be provided under each of the social assistance programs, for example.
Sure. You know, this is one of the trickiest questions in social protection, and there is no definitive methodology that we see consistently applied across countries. It's really a tension between finance ministries focused on affordability and social stakeholders who are focused on adequacy. And sometimes this intermediary principle of acceptability. In no country in the world, rich or poor, are social protection benefits enough to eradicate poverty. Poverty exists regardless of the size of the benefits. And one of the important things is to put in place a benefit size that is acceptable across all the stakeholders so the program can get off the ground. And in so many countries, we see then a progressive escalation of benefits over time as policymakers assess the impact. So certainly the most adequate benefits are the most useful, but we don't generally see sufficiently adequate benefits in initial stages of program design.
Thanks very much. Margaret or Alex, would you like to add any comment to that?
Sure. So go ahead, Margaret, please. I will intervene after you.
There's one possible benchmark that is, and I agree with Alex. Unfortunately, we don't have enough data on national poverty levels, but in countries that have done recent poverty or household income and expenditure surveys, from which basic means, the basic, poverty level can be derived, that gives a clue as to what would be the very minimum level at which households can survive. Now, I'm not saying that people should get benefits at the level of the poverty line, but that poverty line where they can be derived, where there is, up-to-date data to allow these poverty lines to be derived, gives a clue. I would say in Fiji, it's very obvious that most social assistance programs, the benefits fall way below the known poverty line. So the inadequacy of most social assistance benefits is evident right there. So, as I say, I'm not advocating that the poverty line should be used to set benefit levels, but it should certainly be used to assess benefit levels. It's terrible when people get social assistance and they're forced to be very poor indeed. Thank you.
Alex, do you wish to add to that?
Yes, maybe very quickly, again, as Michael already mentioned, that's probably one of the most difficult questions in social protection, but we are not only talking about levels here, but also the changes. And I want to again emphasize that the current environment we are facing, it's very different in terms of inflation that we faced just recently, where we are talking about 1-2% inflation per year. And in this environment, it will be even more important that the governments take a look at what's at least at retaining the real value of social protection benefits over time. Because as I already mentioned, if you take 10% inflation and you don't change basically your benefit for 5 or 6 years, you basically lose 60, 70, 80% in terms of real value of benefits. So that I think also needs to be taken into account going into the future and defining the benefit package. Thank you.
Yeah, thanks very much, Alex. Of course, one of the critical issues is as I believe Michael mentioned, was the affordability and finding fiscal space to increase the level of benefits, whatever measure we use to decide what they should be. Anything that increases the cost of social protection benefits does place a real burden or a challenge for ministries of finance as to how that can be afforded. I know that you in the Samoa office have been looking at the fiscal space in your countries. Did you find anything specifically there that would help to point the right direction for that?
Not really, David. I think the issue with Pacific Islands in general, that's still very high reliance on overseas development assistance. And I think the discussion would need to happen in development space, how reliable it is going into the future in terms of flows and levels of assistance, because it helped countries to avoid actually fiscal disasters and accumulate public debt. But that sustainability, as you said, over time, especially if you try to expand coverage and also try to make sure that benefits are not eroded, I think that will still raise a lot of questions how you can finance that. So I totally agree with you.
Yeah, I certainly think that what we've seen since COVID is that a lot of the funding from development partners has in fact gone into improving social protection programs, but the question of how long they will be sustainable for is a major issue, because it would require development partners to continue to finance social protection into the future, unless the Pacific Island countries can really see some strong recovery prosperity and economic growth and increases in GDP going forward. And we have seen that many of the governments have been severely squeezed as a consequence of the loss of tourism revenues, the loss of taxes, and so on. So yeah, that's a big challenge. I'm not sure that that has answered your question, Ravita. I think it just does indicate that it is a very challenging issue as to how we can, in fact, support the most vulnerable in very challenging times when every source of revenue is being squeezed. I noticed that Sosafina from Samoa has mentioned the benefits that do flow from having the opportunity of sending people to Australia and to New Zealand on the RSE and the other seasonal workers programs, and that does provide, and indeed continues to provide, a source of remittances. But one wonders also whether sending so many young people, and they generally are young people, overseas to work in Australia and New Zealand is actually the best course of action for the countries themselves, because it might well mean that domestic economic activity is squeezed. And I wonder whether any of the panelists have thoughts on how best to balance the need for domestic economic activity with the need for promoting remittances as a supplement or as a gap filler while we wait for economic recovery in the Pacific Islands themselves. So maybe Alex, would you like to have a go with that one?
Well, the interesting fact, David, is that remittances actually in Samoa increased during the COVID times, which is actually remarkable considering that they were already at a very high level. Actually, they reached an unprecedentedly high level last year with basically 30% of GDP. And I think the reliance on them is so significant. That's probably another reason where the government is probably not really worried that much about expanding formal social protection system, because even if they do, it would be probably at the expanding maybe from 1-2% of GDP to 5% of GDP in terms of formal social protection fiscal impact. But we are talking about 30% of GDP, which basically people get directly in terms of remittances, as you mentioned. So that has remained a significant source of supporting livelihoods, because without that, I think socioeconomic impact would be much more significant and broader in Samoa, given that basically there was zero tourism during the COVID times, and it's still pretty much at the zero level. So I'm not sure that's answer your question, but that's pretty much what is happening on the ground.
Yeah, thanks very much, Alex. Would Michael, would you like to add to that?
Sure. I think this is another opportunity for comprehensive strategies to maximize the developmental impact. If migration and remittances can contribute economically in the short term, reverse migration and the associated investment can contribute to the longer term development. But this has to be part of a larger strategy.
Margaret, do you have any thoughts on this, having spent a lot of time looking at the data?
Well, yes, David, I would just like to add that, of course, migration, mobility has been a traditional strategy of Pacific Islanders all along. It's almost nothing that, people have for generations in the face of, hardship, how they've moved on a temporary or a circular basis. So I think this will happen if there was ways in which government can have policies that increase the utility of the you know, the spread of wealth, the distribution of wealth that comes through remittances. That's a bit of an issue. But Pacific Island people, I think they'll continue to do this. They've always done it, and it's a natural response to hardship. Yeah.
Thanks very much indeed. I guess for me, here in the statistics division of SPC in New Caledonia, one of the questions that one of the points that's been mentioned has been the one of data, and I know that it has been quite challenging in some countries to collect the necessary data for the SPI. One of the things that I would like to encourage all governments to do is to make more administrative data available. I mean, we know that when we're looking at the SPI, that all the programs that we're investigating are basically government programs, and it's public expenditure that's going into the social protection programs that we are interested in. But it is still very difficult to identify the amounts of expenditure that are being provided by governments for social protection. And it's even more difficult, I think, to identify the number and the gender, particularly, of beneficiaries that are receiving the benefits. And I would say to all the governments that if the information that must be collected as part of the budgetary processes, if that information can be made available more readily to the ADB and to other partners who are interested in supporting social protection, it will actually make everyone's work a lot easier, because it will be so much better for calculating the social protection indicator, and it will enable data to be collected more frequently. Alex mentioned that household income and expenditure surveys are only collected every 5 years or so by most of the Pacific Island countries. But the challenge that they experience is the fact that the national statistics officers and the budgets that are provided to the NSOs are often very constrained themselves, and the capacity to undertake more frequent household surveys is in fact quite limited. Much as we would like more data on household surveys to be available, it is simply a practical issue of whether the countries actually have the wherewithal to undertake such surveys, because they are quite comprehensive and they do take a lot of time and it often costs quite a lot of money. I wonder whether there's any examples, particularly Michael, whether there's any examples of more cost-effective ways of collecting information for social protection.
Yeah, that's a really good question. And some countries have been able to decentralize collection of individual information using apps that enable people to update their own records. But in terms of the more macro data that goes into the SPI, that's a really good question. I haven't seen any interesting or innovative approaches for that.
Okay, thanks very much. I think we're actually coming towards the end of our time. I don't see any other questions in the Q&A box at the moment, so perhaps I can just move on in our agenda to invite Wendy Walker to make a few closing remarks.
Yeah, okay. Well, thank you very much, David. This was a super fascinating hour and a half, and I really want to thank all the speakers and participants for the great set of presentations and discussion, and you, David, for the very able moderation. I mean, especially I want to thank Margaret for taking us through the SPI findings and giving an understanding of the changes that have been underway over the past decade, and immediately the changes from and stresses of the past 2 years with the impact of the COVID pandemic. And to Michael, who amazingly looks like he's connecting on a flight right now, for the view to the future, for providing the view to the future and possibilities for system strengthening, policy and program focus going forward in the Pacific region. Also to Alex, who I think did a great job at situating the findings into the real and emerging challenges on the ground and underlining the usefulness of the report, and for Director Grace, for also contextualizing this in the context of at the country level for Cook Islands and the immediate next steps in strategic planning, system strengthening, program design, and MIS, and the way in which all of these things come together, and how this effort at pulling together the SPI data for the region is useful for them. Also, I think that one of the most important things that we tried to do in this round of the SPI, as Margaret said, it's the 4th round, and every round we've tried to strengthen it and to find ways to make it better. So this time was really to take this deep dive into the disability data, which I think is a real contribution for the region, both for Pacific and for Asia. The COVID response, to try to capture some of this real-time evolution and thinking, and then the addition of the chapter on the future directions helps to also put, I think, a broader context for the entire initiative. But the question that you were just ending there, David, on the challenges of data collection, on sustainability and improving the quality of data, are really absolutely essential. And I think that we all will continue to strive there. So we are already thinking about the next round of the SPI and look forward to discussing with stakeholders in the regions on where to focus some of the future deep dives, maybe on labor market programs, for example, and how to strengthen and make a more sustainable data collection in the future. Because the more, as you said, governments are able to develop these systems of data collection and analysis themselves, the stronger the entire system will be. I won't go over any of the points, which I think were fantastically captured, and so nothing more to say. But the last thing is really, please also join us next week on the 14th of June for another session, which will present the findings from the SPI for Asia, for the Asia countries. And there we're going to have a deeper dive on the constraints and opportunities in producing and analyzing social protection data and statistics at the national and regional levels. This webinar will be co-hosted with our colleagues at ILO, who have also been co-authors of the report, particularly on this issue of data and statistics. So I hope everybody will come there, and that will round out the full picture. We'll be publishing both reports a little bit later this summer, but I'm really very happy that we had the chance to share here and also have just these fantastic speakers, each one of them, for helping to really share not only what the findings are, but that future thinking and a better understanding about what's happening in the region. So thank you very much.
Thank you very much indeed for those fine closing words, Wendy. And I do encourage everyone to join the Asia presentation next week, as this will provide an interesting contrast, if you like, with the Pacific situation. So finally, in closing altogether, I would just like to thank our panelists. Thank you, Ananya, for her opening remarks, Margaret and Michael, as well as Alex and Grace, and of course Wendy at the end. Thank you all sort of more than 50 of you who have joined the presentation this afternoon. I hope you found it very interesting. If you have questions, if you still have questions, you can email one of the colleagues from ADB or myself, and we'll be quite happy to try and get back to you. And of course, I would also remind you that the presentations will be on the website, as indicated by Paula, and Also, there will be a recording that's available on the ADB website as well. So thank you all for participating. I hope you found it interesting. It's certainly an important topic that will become increasingly important in the coming years, I suspect. And we look forward to welcoming you again for a future webinar. So thank you very much, everybody, and I hope you have a good day for the rest of the day, wherever you are. Thank you very much.